So welcome everyone to the webinar, Organizational Resilience Part 1, Organizational Commitment, Workforce Assessment, and Leadership Quality. Feel free to type your name and location in the chat, again, if you're just now joining us. This is the 13th webinar in our 2024 National Health Service Corps Empowerment Initiative, Advancing Clinician Wellness and Health Equity. Today, we're launching the Organizational Resilience webinar series with our lovely speaker, Dr. Rosandra Daywalker. We saved this series for the end of our curriculum this year because we wanted to make sure everyone had a good foundation of the challenges that can come with serving in health professional shortage areas and addressing the health disparities and social determinants of health that are seen in these agencies and communities and with your patients. Considering all of those challenges, we wanted to ensure that NHSC-approved sites are equipped to support the NHSC participants who join their teams, and of course, supporting all the other employees in their agencies. With that in mind, one thing you will hear about in today's presentation and in future webinars in the series is that the whole team really needs to feel appreciated, included, and supported for the work of your organization to go smoothly and for everyone to feel a sense of belonging. So while this presentation is geared towards supporting your NHSC clinicians, the larger goal is to create a work environment that's healthy and resilient for all of its employees, with that end goal, of course, of being to provide the highest quality of patient care. So over the course of this webinar series, we'll explore 6 domains of evidence-based and promising practices shown to increase clinician well-being identified by the National Academy of Medicine. We'll provide action steps to build organizational resilience and highlight tools and resources to help you develop a plan that meets the needs of your particular organization. Today, we're going to dive into the first 3 domains: organizational commitment, workforce assessment, and leadership quality. Be sure to register for the rest of the webinars in our ongoing series to learn more about the policies, workplace efficiencies, social support, and team-based care approaches that can support organizational resilience. Part 2 will be next Thursday. Part 3 will be July 24th. And then on August 14th, we'll have a grand rounds on fostering organizational resilience. So if you are in a leadership position or a staff support position at your site, we're just really happy that you've joined us today, and we hope you benefit from this webinar and can share the recording with your colleagues who couldn't make it. So I'm really happy to introduce Dr. Rosandra Daywalker to you all today as our presenter. Dr. Daywalker is a transformational leader in health, safety, and well-being. She holds double board certification in occupational and environmental medicine and lifestyle medicine, and is currently a PhD candidate in public health. As a NIOSH Total Worker Health doctoral candidate at the Southwest Center for Occupational Environmental Health, University of Texas, Dr. Daywalker is making a national impact as the first person in the country to hold this distinction. As co-founder and chief medical officer of Access Safety Consulting, Dr. Daywalker helps to provide holistic and innovative solutions to workplace health, safety, and well-being. She also serves in leadership roles for various organizations such as the American College of Occupational Environmental Medicine, American College of Lifestyle Medicine, Association of Clinicians for the Underserved, and as a founding advisory member of the Society for Total Worker Health. Dr. Daywalker's honors and achievements include the 2023 ACU Excellence in Health Equity Award, 2022 ACLM HEAL Scholarship, Nathan Sostrin Unbeatable Mind Scholarship, Quality Improvement Research Award, and many others. Her international experience includes community health leadership in Haiti and medical capacity building in Vietnam. Dr. Daywalker graduated with the highest honors from Morehouse School of Medicine, where she was inducted into the Alpha Omega Alpha Honor Society and served as chapter vice president. She earned her undergraduate degree from the University of Miami as a Foote Fellow and Ronald A. Hammond Scholar. Dr. Daywalker drives change at the individual and system levels through a trauma-informed, multidisciplinary approach to care, programming, and policy. Her current research focuses on how the trauma-informed and total worker health approaches can be applied to workplaces. She loves to give back by mentoring and teaching. At the heart of Dr. Daywalker's work is her belief that genuine, positive connections with others and the world around us are fundamental to a healthy and fulfilling life. I'm really excited for you all to hear from Dr. Daywalker today. I'm confident you're going to learn a lot from her and her experiences and her expertise. There will be plenty of opportunities to engage with Dr. Daywalker and fellow attendees throughout the presentation through polling, the chat box, and by raising your hand to speak. So please make use of these opportunities to interact with one another today. Before I hand the mic to Dr. Daywalker to get us started, I do want to go over a few housekeeping items. This webinar is being recorded, and a link to the recording will be emailed to you all within 2 business days. The PowerPoint slides for today can be found on the webinar registration page, which we will link to in the chat, along with a direct link to the slides. If you did miss any of our previous webinars, you can find them, the slides, the recordings, the transcripts, all on our webinar information page. And we will have time for Q&A at the end of the presentation, but Dr. Daywalker and I will help keep an eye on the chat and the Q&A box, and she will try to answer questions throughout the presentation. So definitely let us know if you've got any questions for her, and type them in the Q&A box at the bottom of the screen. If you do have a technical assistance question, you can contact our colleague Josh. His contact info is pasted in the chat. And polling will be used throughout the presentation using the Slido platform. So you'll see on your screen now an example of one of these Slido polls. The first option to participate in the Slido poll is to use your cell phone and that QR code on the screen. You'll have to enter a password, which is on that screen as well, to enter the Slido website. You can also manually navigate to the Slido website if you want, using the link provided, and you'll have to enter numeric code and password as well. But once you've got that Slido page open, it'll automatically update with the next polling question as long as you keep it open throughout the presentation. And we know that it'll take a few minutes to open up Slido and enter your responses, so we will be patient as we wait for you all to respond. And it looks like some folks are jumping in now to respond, so thank you so much for participating. Finally, we would really appreciate your feedback on today's session. So definitely complete our survey at the end of the webinar. Let us know how we did and how we can make improvements. To see closed captions, you can click on the CC icon or where it says show captions in the bottom of the webinar window. And with that, I'll hand the mic to Dr. Daywalker to get us started.
All right, fantastic. Thank you so much, Molly. It really is an honor and a pleasure to work with you as we have over the past few years, and also to get to collaborate with HRSA and NHSC, because I truly believe in the work and the mission. And so it really is, I'm very grateful for this opportunity to come back and speak about this topic yet again. Looking at the Slido poll as people are logging in terms of your roles related to the NHSC, so I see we have several site points of contact, as well as some site staff. We have a current NHSC scholar who's in the field. We've got NHSC site staff, clinicians. Not applicable. I would love to know in the chat what the not applicable might be. Oh, maybe that's someone from from our group. Very cool. All right, so I think we are ready to move on. So in terms of the objectives for today's sessions, our goal is for you at the end of this to be able to define organizational resilience, to discuss the significance of organizational commitment in terms of organizational resilience and well-being, to identify evidence-based and best practices for assessing workforce well-being, which is a practical part of fostering organizational well-being, discussing the significance of leadership, and as well as exploring how a chief wellness officer or officers can support those programs, policies, procedures, and goals when it comes to organizational resilience. Next slide. So what is organizational resilience? We've heard the term thrown around a lot, especially over the last several years. Even before COVID, there started to be these talks in the healthcare system around staff and clinician well-being, And then we started to hear more about this concept of resilience. And then some people even started to become a little bit cynical about that term or that use, when they felt like, well, we're about as resilient as it gets. How much more resilient do you need us to be, especially in the face of very sometimes difficult circumstances, or lack of resources, and those sorts of things. So in this context, in this discussion, we want to focus more so on organizational resilience, and that is an organization's ability to continue to function in the face of adversity, not simply surviving adversity, but the ability to adapt and transform to meet challenges. So this takes the onus off of the individual or a few individuals to be resilient in the face of adversity, but to look at it as a systemic situation, to look at it at the organizational level, to understand what is in place at the organizational level that actually creates that resilience and that ability to adapt. So planned resilience is related to a function of planning and preparing for future crises. We have to exist in reality that there will be difficulties and challenges that arise throughout the course of business, as we say. We saw it with, for example, COVID the last few years, and with different, for example, in Houston, we just had Hurricane Beryl, and so several systems have been affected by things like flooding and loss of power. And then we think about adaptive resilience as adapting to chronic stresses and acute shocks. And everyday resilience is the ability to function through routine chronic stress in day-to-day practice. So for those who are working in systems or situations, healthcare can be tough, dealing with people sometimes at their best or sometimes at their worst moments in life is tough. And if we still maintain our humanity in these moments, we can sometimes take on those stresses and those emotions and those chronic stresses in the day-to-day practice. So how do we build everyday resilience as well? It's not that having resilience or fostering resilience is somehow going to prevent or eliminate our staff and our clinicians from facing high stress environments or limit their exposure to factors that might contribute to burnout. However, the aspiration is that by developing resilience at a systems level, as well as the individual level, that we are better equipped to respond to those stresses when they arise, such that we can enable not only the organization, but the people that are in our stead to better support their own well-being as well as that of their patients. Next slide. So in terms of today's discussion, we are drawing very heavily from the National Academy of Medicine's body of work around the 6 domains of evidence-based and promising practices shown to increase clinician well-being. And I know this conversation is focused around clinician well-being, but you'll hear me use different terms interchangeably. I might use clinician, I might use healthcare professional or healthcare worker to be more inclusive, understanding that our systems require a whole team of people to make our work successful and sustainable. Everybody from the person you meet at the front desk to the security who is maintaining the safety on the grounds to janitorial services who keeps our environments healthy, safe, and health promoting to administration. And so you'll hear me use some of these terms interchangeably, but essentially they did identify 6 factors or 6 domains which are listed here. And we'll be focusing on the first 3, which are organizational commitment, workforce assessment, and leadership. In another subsequent webinar, they will cover policy, efficiency of the work environment, and support. Now, Molly mentioned a few things about my expertise or my background. A lot of my work or my passion lies in a combination of a couple of places. I'm studying my PhD to get into total worker health. And what is total worker health? This comes from the CDC. This is a CDC, National Institute of Occupational Safety and Health program, and it basically defines it as policies, programs, and procedures that bring together both our traditional understanding of safety and well-being in the workplace, things like protecting people from chemical exposures or slips, trips, and falls or workplace violence, that sort of thing. Bringing that together with more modern health promoting, illness prevention techniques, like what we might have considered, or sometimes people might colloquially call wellness programs, but more so health promotion, if you will. Really integrating the two and understanding that they're not two separate entities to ultimately advance workplace well-being or worker well-being. Initially, I came into medicine, very traditional, and I started off in surgery. And while I might have been thriving, I noticed that maybe a lot of my colleagues and partners weren't, and that people were exhausted, and people were depressed, and people were anxious. And this was several years before COVID. And I really thought to myself, my God, I think that there's a way to do this. There's got to be a better way. And not only were people exposed to a lot of the factors related to burnout, but also just plain physical and psychosocial hazards, right? When you think about, what a toxic workplace can do to a person, how it can affect their engagement or their safety practice behaviors and that sort of thing. And so when I made the switch to focus more on public health and occupational and environmental medicine, it was like a breath of fresh air, seeing how the people in the safety, environmental health and safety world looked at this sort of thing. Really looking at it from a systems level, as opposed to putting all of the onus on the individual and saying, well, you need to be more resilient, and what's wrong with you, and why are you burnt out? And saying more so, well, what's going on in our environment that is leading to people making, having accidents or leaving the workforce or being unable to complete their jobs in the way, that we think that they can. So I think that the way that the National Academy of Medicine approached it in recent years is very much aligned with sort of what I know I've seen in the occupational health and safety world, in terms of prevention and systems level and looking at the environment. So that's what we're going to focus on today. Moving on to the next slide. So a few of the things I want us to keep in our mind as we're approaching or discussing this topic, and I don't purport to that this will cover every single idea or concept related to this, more so to really spur that dialogue and to give some really powerful resources in terms of how to start on that journey or continue on that journey if you're already someone who's leading that charge in your organization, maybe to learn something new, or most excitingly, to challenge what we're saying, because we're seeing how information is constantly changing, technology is constantly changing, how we understand what it means to live, be, play, and work. And so it's really an opportunity for us to really discuss this and think about this, maybe take some really good take-home points or plans or ideas back to our organizations. And so here are just some guiding principles to keep in the back of our mind as we're discussing these things for implementing interventions in this realm. Number one, focus on assets and bright spots. The human brain is primed to focus on the negatives, or the shocking things. And that's just, a lot of people think that's just an evolutionary thing that helped protect us from things like predators. But in today's world, where we maybe aren't being chased by saber-toothed tigers, it still can be tough to pull away from what's wrong, and sort of that illness-based practice or that deficits-based practice, and to focus more so on our strengths and our assets and those bright spots, and to elevate them and to grow those aspects. And so that's just one thing to kind of keep in mind moving forward. Number two, focus on system interventions, right? So going back to, in terms of how we're going to look at this, thinking about it from a systems level. What are we doing in terms of our policies? What are we doing in terms of how we actually carry out those policies, right? It's one thing to have it in writing, and another thing as in terms of how we actually walk the talk, and what programs we have in place. And then it's not to say that the other levels, such as educating and training, and individual responsibility, don't have a place. They certainly do. They are all a part of the big picture. But again, in the field of environmental health and safety or occupational health and safety, we think about hazards and interventions and safety, those kind of fall a little bit towards the bottom when we're thinking about interventions. So really focusing on that systems level. And then number 3, committing to culture and systems transformation. We'll talk about that a little bit more on the next slide, because I think that is extremely, extremely important, is that culture and systems transformation. Number 4, co-create solutions. No longer is it enough to come in to look at a situation and say, I know what's best for that person or for that community or for those frontline workers. We really have to partner with each other, cut out the silos. Someone may be working in HR, someone may be working in industrial hygiene. It makes sense for us to have these conversations together because we're really, at the end of the day, all working towards the same thing, and that is enhancing our organizational safety, well-being, and resilience. And so it doesn't make sense for us not to have these conversations and to create some of these solutions together. And then finally, measure what matters and keep it simple. A lot of surveys out there, I've heard people say, oh my goodness, we are surveyed out. And that can be a real problem because then people may become disengaged when it is time to survey and to survey again. But we need some data, we need some numbers, we need some stories, we need to know what's going on, and we need to know if people are okay or not, and we need to know if our interventions are working or not. So it's not to say stop surveying and stop gathering data, but more so to say, keep it simple. Less is more, or more is not always more, and measure what matters. Figure out what are those measures that will actually get you the information you need, as opposed to just adding and adding and adding and creating 4-hour, 5-hour, 6-hour long surveys that may actually counterproductively contribute to burnout or contribute to disengagement. So measure what matters and keep it simple. All right, and moving on. So like I said, I was going to go back to that concept of organizational culture of safety and trust. And this is a big one, at least for me personally. I think that in some of my presentations that I create, this is a presentation that is created by HRSA, approved by HRSA, because we have to have certain standards. But in some of my presentations, I have a cartoon that I like to have where it's this cartoon character dog, and he's sitting in a burning house, okay? And in the original picture, he's surrounded by fire. And, on the next slide, he just says, this is fine. And I used to adapt that cartoon to sort of depict how the flames surrounding this cartoon comic dog, are like the things that contribute to a lot of our issues and challenges in terms of workforce well-being and resilience. Things like, workplace violence, discrimination in the workplace, exposure to illness, lack of PPE, that sort of thing, pay disparities, you name it. And, how sometimes people who might be very well-meaning, very well-intentioned may come in and say, have you tried being more resilient? It's not enough, right? That does nothing to put the flames out, or even, in this case, maybe giving someone a glass of water who's sitting in a burning house. Yes, they can drink the water, maybe they can toss it on their head, but it's not going to do anything to eliminate the flames that are building around them. So we have to think about, how do we put those flames out, first of all, and eliminate the acute issue? And then what do we do? Not only do we put the flames out, but what can we put in place to prevent future fires, for example? Could that be a fire extinguisher? That's one way. It's still a little downstream. Smoke detectors, still a little downstream. So what else can we be doing at the systems level to not only eliminate these issues or challenges, but also to prevent them from a very upstream situation? So I think about organizational culture of safety and trust as sort of the foundation to all of this. Very, very, very difficult uh, to put in place programs that are supposed to promote well-being in the face of complete lack of physical and psychosocial safety. Safety has to be at the foundation, as well as trust. Otherwise, you're going to be met with cynicism. People who say, you want me to do this smoking cessation program, you want me to quit smoking, but I come to work every day and I am exposed to the worst respiratory toxins and I don't even have the proper respirator. Similar situations happened in healthcare where people were encouraging, again, very well-meaning, very well-intentioned, were encouraging all kinds of wellness programs, but didn't take into account what was going on in people's daily lives in terms of the pressures they were facing from an administrative burden, from an electronic health record burden, from poor supervisor relations, from pay disparity and discrimination. So doing that step challenge did contribute or could contribute to their well-being, but it did nothing for all the other issues they were facing on a day-to-day basis. So I encourage us to prioritize building that trust and confidence amongst your workforce. And again, to look at those policies and practices. Sometimes we have policies in place that have not been updated in 20 years. And maybe they made sense 20 years ago, but they might not make as much sense in 2024 with the way things have evolved. So looking back at those policies and practices that really help employees feel joy, appreciated in their work, to feel psychosocially safe, to feel psychologically safe, that they can speak up and that they have a voice, as well as to align those interventions with values like compassion, respect, equity, inclusion, and ethical practice, minimizing those barriers for and actually encouraging our staff to take care of their physical and mental health, and actually modeling that, right, is a huge one, and including our staff, our healthcare workers, in not only in assessing and developing those policies, practices, and interventions from the start, because a lot of times people who are at the front line actually get left out of those conversations. By the time those interventions trickle down to them, they may not even make sense because they don't apply to how they're actually working in their day-to-day life. We've seen that time and time again. And so just thinking about that culture of safety and trust. Molly, I need to take a very, very, very brief intermission to just fix something on my computer. One moment, okay?
No problem.
Thank you.
If folks want to type anything in the chat about what your organizations are doing to help build that trust and psychological and physical safety at your organizations, feel free to throw some responses in the chat while Dr. Daywalker is situating her computer.
Okay, and we're back.
Okay. Thank you.
So I've seen this in the corporate world, going back to those guiding principles. Last thing I'll say about that culture of safety and trust, I've seen it in the corporate world, in the industrial world, where if people don't trust the intentions of leadership, then it's hard for them to buy in to those programs or those policies, et cetera. So building that trust, it helps people to feel more engaged, to feel better about coming into work and buying into those initiatives that really are aimed at improving their well-being. All right, next slide. So let's talk about organizational commitment. We had the three. So the first one we're going to speak on is organizational commitment. So when we think about organizational commitment, we're talking about a cross-cutting commitment to workforce well-being and organizational resilience, okay? When the National Academy of Medicine was thinking about this, they looked back at this landmark report written almost 25 years ago, but it's still as relevant as ever, which is called To Err is Human, Building a Safer Health System, where they really talked about or called for a systems approach to patient safety, a systems-based commitment to clinician well-being, not just saying, okay, these clinicians are making mistakes or they were having these adverse events and really, playing the shame and the blame game, which has been so prevalent or was so prevalent in the past, and sometimes you'll still see it today. But really looking beyond that and saying, what is going on in terms of practice that allows for these sort of issues to occur, or makes our workers feel like they need to create these workarounds, or what kind of pressures are in place that are creating circumstances where people are so burnt out that they cannot focus or they cannot complete the work in a safe manner, and really looking at the system as a whole. And so now that's where you started to see a lot more of those root cause analysis discussions, taking out the shame and the blame out of the conversation. So we think about how we can manifest these commitment. And for example, in this regard, in this conversation, we'll talk about establishing a workforce well-being program and also including measures of workforce well-being within the organization's strategic plan and hopefully a dashboard. So you can look at what is going on in your organization at any point in time and think of it as the current state of your workforce. And maybe you have this aspirational goal in terms of the desired state. And so you need a strategic plan somewhere in the middle to make that a reality. So we can start by looking at things, and we'll talk more about the measures later, but we can start by looking at things, on a national level, international level, and then bringing it down to our organization's level in terms of burnout scores, in terms of staff satisfaction ratings, in terms of turnover rate or retention rate. And also looking at and understanding what are the contributors to burnout. We know what they are theoretically. Are these the same things that the staff in our organizations are experiencing? For example, it took a while. We finally got there to really acknowledging and accepting that spending too much time on documentation was contributing to burnout. Also, issues around not having enough decision-making authority. That's anyone. That's not just related to a clinician or a healthcare worker, but that's anybody in any situation. That lack of autonomy could contribute to burnout. Feeling undervalued, no work-life balance, etc. And then also looking at our leadership and manager skills. My opinion, not necessarily the opinion of HRSA, but a good supervisor can really make someone's experience, just like a not good supervisor can break someone's experience. And so understanding what makes a good leader, how can we foster that leadership, those leadership skills in people, because leadership can be built, it can be grown. It's not necessarily something you just have or you don't. But sometimes we find that the people who are placed in supervisory positions and whatnot maybe aren't fully equipped to be in those positions. And so it can make those kind of interactions hard. And a lot of our experience of life and of work are the people we work with. And so what are we doing to build those leadership and manager skills, and even to assess them to begin with? And then, of course, things like organizational plans to keep the workforce physically and psychologically safe during disasters and public health emergencies. What plans do we have? What resources are there to support our staff who are in distress, and more? Next slide. So there are going to be things kind of working from in terms of how we treat or manage issues as they arise, to how we prevent them and promote health overall. So foundational programs, in terms of displaying that organizational commitment, Having these things in place is a demonstration of that commitment. That means that we are putting effort, we are putting financial resources and personnel towards these things to signal that we actually care, and it is not just something that we say we care about. Safety net resources for staff, for healthcare workers, for clinicians in distress and quote unquote distress, resources to address the needs of individuals during major life transitions. Again, when people come to work, we don't leave our life at home. We come as a whole person. And sometimes that whole person comes with things that are going on in our relationships, with our families, in our personal health, or in other things like making a move or having a child or different things like that. And so what kind of resources do we have that can maybe help assist these major life transitions? And not to say that our organizations are responsible for every single thing that happens in our workers' lives, but the things that we can control and the things that we can assist with, it makes sense to put some kind of resources towards it in terms of support. Number 3, system-wide approaches that provide clinicians the opportunity to identify and prioritize local factors that might irritate them, or a process that empowers them to address these. Again, going back to having a voice, having a seat at the table, being able to help design the workplace or the workflow, being able to give those frontline perspectives. I'll use that example again of electronic health records. Again, well-intentioned, well-meaning people who created this beautiful, amazing technology. But it was a different thing to see how it was implemented in the workplace and how it affected a lot of people's ability to spend more time doing the thing that maybe they came to medicine to do, which is to take care of the patients. So making sure that those avenues for feedback are intact, are available, such that when these things do arise, that people have a way to express them, and hopefully that that feedback is taken and used to improve the system or to improve those processes. Next slide. Reducing the administrative burden placed upon providers. Okay. I know a lot of these things are maybe easier said than done, but we can always take steps in the direction. Okay. And so what are those things that the providers or clinicians may feel like are more of an administrative burden? We have to ask. We don't know if we don't ask or observe or assess, but understanding what is it that is directly within the scope and practice of our providers versus what are things that may help, with things like billing or help with things that are more of an administrative nature, but maybe could be taken off of the plate and distributed in such a way that still allows our people to do the work that they really came to do, that patients can feel cared for, feel like they're actually getting what they came to get, and feel heard, and really puts the power back on everybody to do the best job that they can. And sometimes that might be, for example, hiring scribes. I've seen a lot of success in different spaces with people utilizing not only in-person scribes, to take the note-taking of an encounter, or to put in, certain information in the EHR, but I've even seen virtual scribes, people who are tuned in via the computer, who are listening in on these interactions and taking the notes, such that once the provider is finished, they can go back, review the notes, and put it in. It saves a lot of time. And I think the major thing is that it allows people to have that interaction that they are so desperately craving in those instances. So that's one way. Encouraging leaders to model self-compassion and cultivate a sense of connection within the organization. Ever heard of that saying, do as I say and not as I do, right? We may sometimes encourage people to take those mental health days, or, to utilize that flexible work from home policy. But it is very hard, especially when you think about power differentials and different factors like that. When my supervisor isn't taking a mental health day and my supervisor is working late into the night and sending emails in the middle of the night. I'm not saying that's a bad thing. It's just we're talking about modeling. But it's in terms of building that trust, we've got to model the things that we're telling people to do in terms of self-compassion and well-being. So we have to walk the talk, and that includes our supervisors, our managers, and our chief executive officers, our executive leadership. Engage in external partnerships to support continued organizational growth and learning related to clinician well-being. Don't have to reinvent the wheel. That's one of my favorite things. I like to work smarter, not necessarily harder or longer. And so I'm always looking for resources that are well-vetted, evidence-based. People have put a lot of time, expertise, and resources into, such as the National Academy of Medicine, such as CDC, the National Institute of Occupational Safety and Health, such as HRSA, who have already compiled a lot of resources that are free and free to the public to utilize, and leveraging those partnerships with these kinds of groups, or even with more local groups that are closer within the city, partnering with local chapters of professional societies and organizations, not feeling like this aspiration or these goals or these programs are to be just shouldered or burdened internally alone, but looking outside, again, to these external partnerships and resources to support your aspirations and goals around clinician well-being. So let's take a break. I want to hear from you all in terms of personally, what factors promote your well-being at work? And I think when you think about what promotes your personal well-being at work, it's easier to think about what kinds of things may be important to your colleagues who are in different positions in terms of what factors we might want to look at or investigate more, or help to promote our overall organizational well-being. So feel free to just jot down any thoughts that come to mind for the group.
And for anyone who wasn't on at the beginning of the call, just you can use your cell phone to connect to the Slido poll with the QR code up there on the slide and enter the passcode on the screen, or you can go directly to slido.com and enter that numerical code and then the passcode. And once you've got that open, they'll stay up for the entirety of the presentation.
Nice. And then we can type, and if anybody actually wants to come off of mute, we would love to hear your voice. If you would like to share out loud with the group, we have a nice and intimate group. And so please feel free to raise hand or come off mute and share a little bit. So I'm seeing things like healthy modeling by leadership, right? It's a huge one. A lot of organizations have the policies in place. They have the programs in place. They've got the initiatives. They've got all the seminars, webinars, webinars, you name it, in place. But then when it comes time to actually making time or giving people the space to do the things, there might be a disconnect. So that healthy modeling by leadership is very important. Leaders being open to change. Yes, one of the more difficult things we can encounter is this thought process or thought pattern, bitty-watty, but this is the way we've always done it. And again, I mean, when you look at how much just society has changed, how much technology, our knowledge base, medical practice has changed, it doesn't make sense for us to keep doing the same things, to keep training people the same way, or to keep encouraging the same detrimental practices of years before that maybe worked in a previous time, but maybe aren't as applicable now. So being open to change, definitely important. Self-imposed boundaries. that's a very good one. What I'll say about that is I've done a talk with a group, with the PCA, around this kind of concept, which is that a lot of people come into healthcare in general, come into healthcare wanting to help people. For a lot of people, it's a calling. It is a personal calling, right? And so sometimes, because it is a calling, we can find ourselves actually being the ones putting the most pressure on ourselves to get the work done, to see one more patient, to file one more grant, to make sure this, that we have enough money to pay everyone next year, to put this program in place. And so sometimes we find ourselves blurring boundaries, working, late into the night outside of work hours, et cetera, because we just got to get this done. And so there is a balance definitely there. And it can be a challenge when the call or the pressure is coming from inside the house and not really externally. So those self-imposed boundaries can be important for sure. Staff. More, I think this kind of jumbled a little bit, but maybe more staff. Not sure on the screen. Leave time, leadership appreciation, good benefits and leave policies, of course. Again, it's not one thing to say, oh, you need to be more resilient, or you need to go and do 10,000 steps, or have you tried yoga? All those things can be very health promoting and beneficial. But sometimes, a lot of times, that's not even what people really need to make this work. Sometimes it's about having good benefits, having good access to healthcare, having appropriate leave policies, because again, we're not robots who come to work and leave everything about ourselves at home. We are whole people with a slew of experiences and other things going on, that requires us to have that sort of flexibility. Schedule flexibility. We've seen a lot of progress in terms of, there are some jobs that just need to be done in person. But there are other jobs maybe that can be done partially or even fully remote. And then also looking at how to exploring schedules in terms of, is it necessary? Will we lose coverage if we do 5 days a week, 9 to 5 versus 4 days a week, 8 to 4, and having supplemental people in to help cover the times that aren't, just thinking out of the box, being creative. Again, it's about being open to change, and understanding that there's so much more in terms of what we know actually works in medicine, of how we can practice the art, not just the science, but the art of medicine and healthcare in general, and social. This is a changing phrase, but I'll use social determinants of health. Social determinants of health, understanding that those minutes that maybe people spend in the clinic aren't necessarily going to be the ones that fully determine their overall health and well-being. So really being creative, thinking outside of the box. So thank you all for sharing. Next slide. So we talked about organizational commitment. Again, signaling, demonstrating that our organization actually cares and is going to put the resources, the personnel, and the time to promoting organizational and workforce well-being. And then now we're going to talk about workforce assessment.
I think we skipped a slide, or do you want to move on, Dr. Daywalker?
Okay, let's see. What actions? Oh, yes, I would like to see that. So we have one more Slido. I want to know, in your opinion, what actions can an organization take to effectively demonstrate its commitment to workforce well-being, right? So we have some options here. Obviously, this is not an exhaustive list, but I want you to take a look at these for a few moments and pick your top 3. I want to see which ones sort of fall to the top in terms of this group and what you're thinking, seeing, feeling, in terms of what are going to be some of the more significant or high leverage points in terms of really, truly, genuinely demonstrating that commitment to workforce well-being. So some of the options we have are recognize and reward employee achievements, provide regular mental health resources and support, offer flexible work arrangements, implement comprehensive wellness programs, conduct regular mental health and well-being training, foster a supportive and inclusive workplace culture, and ensure transparent and open communication from leadership. I'll give you a few minutes and then we'll talk about it.
And it looks like we can only enter one response, so just keep that in mind, Dr.
Okay.
Daywalker. Yeah, so these are probably top responses that folks are submitting.
Got it. Feel free to post them in the chat as well if you wanted to put more than one. And again, I'd love to hear from you. If anybody wants to give some of their perspective, we'd love to hear from each other. It's boring just hearing my own voice.
And if anyone would like to do that, there's a little raise hand icon at the bottom of the screen. If you click that, we'll send you a note to unmute.
So we've got a few here. And so far, ensuring transparent and open communication from leadership is at the top. Someone, and again, no pressure, but someone who chose that one, who chose ensure transparent and open communication from leadership. Would you like to talk about that a little bit?
I don't see anyone raising their hand yet.
That's fair. So I think that this is one of those things that contributes to what we spoke about earlier, which is trust, right? One thing that I've learned, through my experiences and my studies is that it's not necessarily the events that occur in some of these situations, but more so if people are informed or feel informed and are heard. And I think that's just in any situation, that not just workplaces. And so, for example, if a major policy change is coming or a major practice change is coming, having avenues in place to communicate those transparently and openly, as opposed to quote unquote surprising people with the change, gives people time to absorb, to process the impending changes, to form an opinion or to prepare for the change. Gives them a sense of autonomy and control, because sometimes things that end up being distressing or even traumatic are things that make us feel completely out of, like we've lost control or we have no control. And so empowering people with information, and you do that through transparent and open communication, is huge. So it may not be that we can change the impending change that's going to happen, or for example, there were some things going on social media about a certain hotel resort in Jamaica, and one of the managers or the owner of the hotel or something, they were showing these videos of him sharing information about this hurricane Beryl that was coming, and it was going to be a very impactful hurricane. But he came out and he gave the information in the way that he openly and transparently communicated what was going on multiple times throughout the process. People were really complimenting him on his delivery. It's not that that was going to stop the hurricane from coming. It's not that it was necessarily going to prevent some of the dangerous or life-threatening effects of that Category 4 or 5 hurricane, but it gave people, it empowered people with information, knowing what's coming, so that they could prepare in their own way, so that they could prepare as a group and weather that storm. And so thinking about transparent and open communication from leadership, I understand why multiple of you chose that as your top thing, as your top action.
And Dr. Daywalker, we do have someone who would like to come off mute. Caitlin.
Yes, yes, please. Hi, Caitlin.
Caitlin, are you able to speak? Trying to get. And Josh, if you could assist, that would be great.
Yeah, Caitlin is still looks muted on my end.
Caitlin, are you able to unmute on your end?
I don't see that.
Okay.
We'll
We're
still work on it. And then
okay.
as soon as we do get Caitlin unmuted, I still want to hear what Caitlin, the perspective Caitlin was going to share, even if we've moved on. Okay. I think, yep, flexible work arrangements because life is happening. It doesn't stop happening. And so we need to have some sort of flexibility for those things. Recognizing and rewarding employee achievements. A lot of times, again, focused on the negative and focused on finding when people make mistakes or they're not performing to the level we would like them to, or meeting those metrics, and punishing them or shaming or blaming or putting them on performance improvement plans. But if we were to reverse that and actually think about more from a strengths-based perspective and how we can recognize and reward people for doing a good job, and take away, the distress and the stress of feeling like, I'm going to be punished if I don't make this metric, can go a very long way for people. And a lot of times it's not that people want to constantly be praised and told, you're doing a good job, you're doing a good job. But again, this extends outside of the workforce. This is just human nature and human psychology. We like to be appreciated. We like to feel valued. If we're spending the vast majority of our wake time in our lifetime at our workplace, then it only makes sense that we would also like to see that same appreciation and feel valued there as well. All right, so we'll move on. So workforce assessment, there's a saying, and I'm going to paraphrase it, but basically the things you measure are the things you can change. So we need to know what's actually going on in the workplace, what's going on in the workforce, to give us a sense of where we need to make those changes or implement those programs. And then also to track if those programs and policy changes and procedures are actually making a difference. Because we'd hate to be wasting money and putting resources and personnel in one direction when that's not even what people need or want in the first place. So there are a host of, for example, standardized tools. We have a list forthcoming. Of course, those things like the Maslow burnout inventory or the professional quality of life tool. So those are going to be those kind of standardized questionnaire type, Likert scale or survey type questions that have been validated by multiple studies that we can use in terms of measuring well-being or burnout and the like similar concepts. But we can also, I also really, really love qualitative stories. I love the qualitative data, the how and the why of these things, what's going on behind the numbers, so to speak. And so that's where things like interviews can come into place, like focus groups, but also something like stay interviews, exit interviews, and we'll talk about that in a little bit. You can also look at your human resources data, your HR data, and benchmarks things like turnover, right? So if you're seeing a lot of turnover in one particular department, then we may want to take a look at what's going on there. Things like absenteeism. Are you noticing that certain departments have a much higher rate of absenteeism than what you would expect, or what's going on in the rest of the organization? Again, those things may point to issues that might be happening within the department itself, or within the overall workforce, and that department happens to be the so-called canary in the coal mine and is actually portending things to come. Or it could be things that are going on in the community. For example, because in a lot of our, like, for example, a lot of our FQHCs, some of our staff live in the same community as the patients that we're serving. And so some of the challenges that are affecting the community are going to affect your workforce. So looking at HR data, for example, and then of course, assessing bias, discrimination, violence, incivility in the workplace. The overall workplace can be a fantastic place to be, but if we are, again, faced with colleagues or supervisors that are just outright or even covertly discriminatory or incivil, or violent, psychosocially or physically violent, then that's going to make a huge difference in our experience. So again, we can look at these things. Some other interesting factors that we can look at are things like electronic health record metrics. That's, I learned that actually through preparing for this presentation. I never thought about that, but of course that would make sense if we look at, for example, how much time people are spending during work hours versus after hours. Volume, if we're noticing that the volume of the inbox is growing, disproportionately. These are things we can pay attention to, that we can track, because they do contribute to burnout, workforce turnover, early retirement, and reduced clinical effort. So there's also that concept, right? People may still be showing up to work, but maybe they're pulling back their best effort because they are exhausted, they are unappreciated or undervalued, or they are distracted by discrimination, they're distracted by incivility, workplace bullying, or just overworked, and are trying to preserve themselves so that they can keep on coming and don't completely fall out of the workforce. Additional leading indicators of clinician well-being, characteristic behaviors of leaders. So again, if we look at what our leaders are doing, if we look at what our supervisors are doing, that can indicate or help us to track or see what's going to happen with our overall workforce well-being. Communicating transparently. And again, these are things that can be learned. These are things that can be grown. It's not that you have it or you don't. We can teach and we can increase our communication skills, whether it's from the individual level or from the organizational level. Nurturing career development and expressing appreciation for completed work. Not only did they go above and beyond, but did they do the work? Because that's what we're getting paid to do. And I know that might sound controversial, but bear with me. Just expressing appreciation. Again, it goes such a long way. Efficiency of the practice environment, which is going to be addressed in another webinar, such as team documentation, team order entry, that sort of thing. So not putting the onus on just one person to put in all the orders, but empowering people to be a team in this effort. Teamwork, 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 peer support. It can also be measured. And then these results can be shared with all the different stakeholders involved, such as your unit leaders, such as the board, and leaders across the organization, so that we can all be held mutually responsible for addressing and improving those results. So not just doing the assessments, not just doing these assessments, but actually sharing the results and using them to make and drive change. Next slide. I just wanted to do a quick plug for HRSA's Health Center Workforce Wellbeing Survey. So the first ever National Health Center Workforce Survey was launched in 2022. A show of hands or in the chat, how many of you have actually seen this or were aware of this national survey that went out a couple of years ago? Okay, I see one thumbs up. So at least one person. And so this survey, they measured several things. So first of all, the people that were surveyed included medical and behavioral health providers, dental, vision, therapists, support staff, admin, finance, facilities, labs, techs, pharmacy, management, leadership, IT, people who get the grants, or QI teams, and patient support. So in a nutshell, just about everyone was surveyed. So it wasn't just about the clinicians, but it was about the entire team that makes these centers run and continue to do the good work that they're doing for our nation. And the goal was to identify factors that were impacting workforce well-being, recruitment, retention, and quality of patient care at the health centers. It was a voluntary survey. And so some of you may have actually participated in it, or your people from your organization did, and the responses were totally anonymous. Health centers are able to see aggregate or group responses so that they can compare their health center to the national averages. But some of the things that this survey measured or looked at were things like how people felt about their work team, such as supervision and leadership, and they felt about their health center, positive workplace culture, support, those sort of things, training, their work experience in terms of the mission orientation, the meaningfulness, excuse me, compensation and benefits, right? We can't leave that out of the conversation. If we're being underpaid, that's a form of feeling unappreciated and undervalued for the hard work we're doing. It also makes it hard for us to live the highest quality of life that we need in terms of supporting ourselves. So workload, moral distress, and then overall feelings about the job. And they looked at all of these things. And so, of course, as you can imagine, they were able to do different tests of significance and regressions, and to look at relationships between these outcomes and things like where the health center is located, or the demographics of the health center or the individuals responding, and how they all linked or may correlated to these different domains. So that's something definitely for you all to look at if you haven't already. Can really give you a lot of great information. And so this is sort of what is helping or helped and is helping HRSA to develop those plans and national strategies, because again, it's one thing to say, okay, we want to improve workforce well-being. There's a lot of different initiatives, programs, and policies that you can put in place, but are you actually making sure that those things match up to what's needed, to what people want? So this is one of those ways that they're doing that to really improve our work-life experience for everyone, not just the clinicians, but for everyone on the staff, because again, it takes a team. The clinician does not, the dental, the dentist, the vision, they are not the entire operation. Someone's got to come in the morning and turn those lights on. Someone's got to make sure that there's grant money to keep these centers running. And so I really love this assessment, and I'm looking forward to seeing how they continue to track this. And then you can let us know if you have any questions about it. Next slide, thank you. This is just a nice list of several validated, for example, burnout assessment tools. But of course, we don't only have to focus on burnout, right? We can focus on a lot of other things. We can focus on well-being. We can, there's the WHO well-being index, for example. We can focus on, like the other things we saw, job satisfaction or engagement. There are a lot of different validated assessment tools out there already, so no need to reinvent the wheel. We can use things that already exist and have been tried and proven. And so those are sort of the links. So once you get the slides, you can access these as well. And then when we're thinking about conducting these surveys, a few thoughts or a few things to keep in mind that can be helpful include intention, communication, consistency, and accountability. So when it comes to intention, we hope that the surveys are conducted with the intention to follow through with issues that are identified. Because again, when we're talking about building a culture of health and safety and well-being and trust, if we want people to continue to give us this feedback, or to truthfully give their opinions or their thoughts on things, then the question is always going to be, well, what are you going to do with this information? So we hope that the intention is to actually follow through if issues are identified. Otherwise, that could, unfortunately degrade trust in terms of that. So without following through, that can create an illusion that maybe the organization is not taking these concerns seriously. So hopefully the intention is there. And again, that the intention is not to single out or to, to blame someone or something. But again, just trying to be curious, coming from a place of curiosity, genuine curiosity about what's going on and how we can make it better. Communication. When conducting surveys, communicate why you're conducting the survey and how this information will be used to support the organization and its workforce. That goes back to that open and transparent communication we talked about earlier. It almost feels like a lot of this is pointing towards trust, building trust, maintaining trust, solidifying trust. And there's a comment, do not make promises you cannot keep. I know some of us have a lot of high goals and aspirations, and maybe eventually you can get there, but initially maybe, try to stick to the things that you actually can commit to in terms of what the survey or the results of the survey might accomplish for the organization. Consistency. We talked about that survey fatigue. So we don't want to create survey fatigue, but we do want to give a sense of regular or periodic kind of surveying. So it's not like we surveyed once in 2019 and then again in 2020, and then we didn't survey until 2025, but giving people a regular tempo so they know what to expect. It helps in terms of having that trust and with the surveys and understanding what the surveys are trying to accomplish. And then measuring so that you can also measure those changes at a normal periodic tempo. So you can see how progress is developing or not, so that we can, again, adjust our interventions if necessary, put more resources towards the ones that are working, etc. And then finally, accountability. Provide regular updates to the workforce on your efforts to actually address any concerns that were identified. Even if it's something that can't be changed, acknowledging that, yes, we heard you, and maybe giving additional context information so that people, again, can trust that this is why we're even doing these surveys. This is why I'm giving this information to you willingly. It's that it goes back to that open and transparent communication. Next slide. How does your organization assess workforce well-being? Are you looking at human resources data, for example? Are you looking at retention, turnover, absenteeism? Are you doing some of those using those validated tools like burnout inventories or job satisfaction scores? Interviews, focus groups, stay interviews, that sort of thing. How is your organization assessing workforce well-being? Anything we haven't mentioned? I would love to hear if you're using any metrics or tools that we haven't mentioned. Turnover and exit interviews, employee surveys. Annual survey. Ooh, we've got stay interviews. Awesome. Quarterly surveys. Yep. Mm-hmm. Yep. And that's okay. That's why Anonymous said, I don't think they are. That's why I'm here today. It starts with one person. That's okay, because everybody in every organization is just on a spectrum, is on their journey to these sort of this sort of culture or these practices. And so all it takes is one champion, one spark to light that fire. So we thank you for being here today, and hopefully you gain some really useful resources, ideas, brainstorming, even connections to help you with this, if this is something that you're trying to take back to your organization because you believe in it and you think that you need to start right away. A lot of annual employee satisfaction surveys. Very good. All right. Next slide. So again, these are just more examples of things that can be measured, such as the burnout scores, satisfaction, engagement, how much time staff is spending on electronic health records, purpose. Do people feel purpose in their work? Because that's a huge one. Team cohesion. You can look at it by site. You can look at it by different departments and disciplines. And the other really fun thing is, because technology has come such a long way, another great creative thing I've seen is the dashboard, where these results are posted in real time. Having a website where people can go and see the results as they're updated, as opposed to, waiting for an email to come out or a newsletter, but a dashboard that shows and tracks these things in real time. And to my knowledge, they actually are not that terribly difficult to set up. And once they're sort of set up, they're very easy to maintain. Just another way to maintain open and transparent communication is having that dashboard. Next slide. Stay interviews. I saw someone, at least a few people mentioned that they actually were conducting these stay interviews. So just wanted to highlight what a stay interview is. And in this kind of interview, it's a little different from, for example, an exit interview, which is done when an employee is separating from that workplace. But in this case, this is used to understand what staff or healthcare workers actually enjoy about their work, the reason that they are staying, and what changes they would like to see. And this can be conducted by someone from your department or a direct supervisor. But essentially, it's almost like in the vein of appreciative inquiry, right? Like, what's actually working? What makes you come back every day, so that we can build on that and create that experience for others so that they can keep coming back every day. And so I think that's a really powerful tool as well that maybe wasn't used as much in the past, but can definitely add that to your armamentarium. Next slide. Here are some examples of stay interview questions. So for example, when you travel to work each day, what things do you look forward to? And so not only can you glean a lot of important information from an interview like this, but you know what it can also do for the person who's being interviewed? It can remind them of the good, of the positive aspects. So people love, talking about themselves, talking about the things they love, right? And so giving people an opportunity to share those positive aspects and those bright spots of their day, of their week, of their job, of the people they work with can be, again, very empowering and very powerful. What are you learning here, right? And what if, might find someone says, well, I'm not really learning anything. That's an opportunity, right? To put some things in place like career development or other opportunities to grow in that capacity. Why do you stay here? When was the last time you thought about leaving? What prompted it? What can I do to make your experience at work better for you? And again, really flips things over, because a lot of times when we're being interviewed or asked questions in the workplace, it's usually not these kinds of conversations, right? It's usually something else. It's usually, something coming down, a performance improvement plan. So what if we switch things on their head and sought those bright spots and those assets and those positive aspects? Next slide. We can skip this. No, we'll do it. We'll do it. I know one person mentioned they did, but I'd love to see if anyone else is conducting stay interviews. Give you a moment to do that. 100% of one person. No. So when I saw this, I said stay interview. I mean, it sounded like exactly what it's called. But that was the first time I'd heard of that. And I said, oh my God, that's that's that makes so much sense. I don't love that. So the majority are not conducting stay interviews. So could this be something that maybe we add to the armamentarium, we add to the toolbox, or that we use to even replace something else that maybe isn't working as well, or have more of these conversations, or encourage these conversations between different groups or different people? Yeah, so I definitely see some opportunity here with the majority, 80% of the five who answered saying no, they don't. So there's definitely some opportunity there. All right, next slide. We talked about this again, can look at things like turnover rates, can look at things like retention rates, which is kind of on the other, the other side of that same coin, and qualitative data from the exit interviews. Again, so the how and the why, the numbers tell one story, but actually hearing the story of people saying their how and their whys and their whats is also very informative. Next slide. Does your organization have a dashboard to communicate your workforce well-being metrics? All right. So, I mean, that's good. So, on one hand, you want to see yes, 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 right, to everything, but the no's are also very helpful because that lets me know that I am not just saying a bunch of repetitive things and everyone's already doing everything. So, what is the point of this conversation? But what I'm seeing is that there's definitely opportunity to improve or streamline some of these processes. And I don't mean just add on top of everything you're already doing, because I'm sure that you are all very busy and everyone in your organization is already very busy, but maybe looking at what we're doing and where can we maybe cut out some redundancy or cut out some of the fat, etc., and put in place some other things that might be a lot more empowering or useful in today's evolved workplace. Other. Okay, I see someone who answered other, so I'm really curious. Is that other? I would love to see in the chat or hear what that other means. And if I had to guess, I think the other probably means that your organization has a dashboard, but maybe well-being is not included. Maybe other metrics are included in the dashboard. What does that other mean?
In the
Oh,
chat.
okay.
Okay, you see it.
So Sandra shared, we have weekly hub care groups and the metrics are shared at those meetings. That's amazing. So people are getting that information on a weekly basis. I think that's awesome. All right. Next slide. So another thing we talked about a little bit earlier, so we'll just reiterate, but again, when you're assessing the workforce, some things may come out, or intentionally you may look for these things to ensure what the status is, and that is about bias and discrimination, workplace bullying, incivility, violence, you name it, and developing a clear policy for reporting, including how those reports will be handled, because unfortunately, sometimes when people report bias and discrimination in the workplace, they end up being re-traumatized by the process of reporting it or how the reports were handled. And so that may not always be the intention, but that is why we have to be intentional about how we empower people to report and how we handle those reports. Can include diversity, equity, and inclusion questions in staff satisfaction surveys if they're not already there, because the evidence and literature already points to how those things positively impact our experience and success in the workplace. And then conducting different things like equity assessments, and they can be around not only racial, but around different like orientation, all the different concepts in terms of equity and how we're addressing them. It's all about being mindful and intentional. And of course, ACU, the Association of Clinicians for the Underserved, their STAR Center has amazing toolkits, and this is just one of them where they take you through building an inclusive organization. And so if that is something that maybe your organization has already unearthed or assessed as something where there are opportunities and improvements to be made, guess what? There are amazing resources already out there for you. So you're not alone in that journey, and you can definitely make improvements and see a lot more progress in that area. Next slide. So we've covered organizational commitment. We've covered workforce assessment. So the last concept we said we were going to cover is leadership. And so around leadership, there are different aspects or action steps you can take, but essentially the understanding here is that leadership, or from my world in terms of total worker health, leadership, we understand helps us to get the job done and to ensure that this is a sustainable practice. We love a grassroots effort, but a lot of these things, they require personnel, they require time, they require effort, and they require money. And so it's almost like a garden, right? You need really good soil, fertile soil, you need good water, you need good sunshine for that seed to grow. It's not enough just to have a seed in the soil, but you need all the different nutrients and all the different things feeding it. And so leadership is one of those ways, is making sure that, for one, our organization is bought in, that our leadership is bought in to our initiatives and programs, and helping to foster that culture. And also making sure that we empower leaders throughout the organization to support these efforts. Because somebody's, we have to give accountability, and somebody to actually make sure that the things are going as planned, and that we have champions who are championing for this. I think this one, appointing a chief wellness officer. In the past, I don't know currently, but sometimes that can be a little controversial for some, because some people sort of took that in the past with some cynicism, saying, well, that we already have too much administrative bloat, right, in our healthcare systems, and that's why we are having a lot of the problems we have now. And so I can completely understand that perspective, and can definitely see some validity to that thought. In this case, I think that in terms of appointing a chief wellness officer, that can be very powerful in terms of having someone who is dedicated to this mission. It can be a strategy for an organization in terms of making sure of demonstrating that commitment to the organizational resilience and well-being. Sure. And so this is how you can strategically demonstrate that, is by putting, quote unquote, your money where your mouth is, so to speak, and saying, we actually do care about that. We don't just care about the output and the productivity. We don't just care about the numbers and the money and the financials. So this is why we have a chief wellness officer, or you can call it chief well-being, you can call it whatever you want, semantic, but empowering at the executive level can communicate very strongly that we actually do care, and that we are going to empower someone and a team to actually implement and carry out these programs, these processes, and these procedures and policies. And so this is a person, hopefully, who comes with the expertise, comes with the resources, and ding, 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 the authority to influence and to implement these changes and practices across the organization. So this person theoretically would be the person who views all the organizational decisions with a lens on well-being. So this then gives that opportunity, whereas maybe in the past, certain changes came down, implementing of different changes to the practice may have come down, that then negatively impacted people's well-being or ability to carry out their job. So this can be that person or that team that says, how is this going to impact our well-being? This is someone who can serve as a thought partner to guide important decisions, to help develop the organizational well-being strategy, to help lead those assessments, to make sure those results are reported, that the changes, the concerns that are made or found through those assessments are addressed, and can identify and implement well-being resources. And so the American Medical Association actually has resources just for that, about establishing a chief wellness officer position and the team around them. So again, just thinking about what does it look like when you don't have a champion or a formal leader for these efforts. You can end up getting these siloed efforts, these siloed initiatives. Frustration can build, redundancy, cynicism. So this gives you an opportunity to integrate all those different efforts to make sure that they're actually doing what you're setting out to accomplish, and keep things streamlined, and again, demonstrate that commitment from the organizational perspective. Next slide. Some of their responsibilities, like I mentioned earlier, could be actually doing or conducting the measurements or those assessments, measuring efficiency of the practice environment as well. So not just how do you feel about it, but actually looking at how are we, like what does the workflow actually look like? Where are there opportunities to improve the efficiency or effectiveness? Developing that organization-wide action plan and determining what resources are necessary and advocating for those resources, right? So having, again, that voice at the executive level, who makes that business case and gets those resources in place. So next slide, question. Does your organization have a chief wellness officer or a similar position? Man, 100% said no. And again, that's not necessarily because, oh, we've got someone who said yes. Again, understanding that our centers already have so much on their plates, and this might not be a priority at the moment, or just something that maybe we've thought about and we're trying to get in place, but it's hard. But it definitely is an opportunity, it sounds like. And again, it doesn't have to be called a chief wellness officer. It can be called director of well-being, can be called anything. But just having that dedicated champion who not only is passionate, but also has the authority, influence, and power to advocate for our workforce for matters that pertain to well-being in the workplace. And if anybody wants to share in the chat if that has been beneficial or not, having that chief wellness officer position, has that been beneficial to your organization's well-being journey? I would love to hear about it in the chat. All right, next slide. This is similar. So for some of you, this answer is going to be the chief wellness officer or similar, but who leads wellness or well-being efforts at your organization? Is someone responsible, or is it a group effort, or is it has it been delegated to HR, for example, or employee health? Who leads those efforts, well-being and wellness efforts at your organization? A chief wellness officer and head of HR. It sounds like those are two separate people who are partnering, which I love. HR, group effort, HR and other committees. We've got a medical support department. Very cool. Nobody. And that's why we're here, because all it takes is one. Previous employer had a quality of work life committee. That is fantastic. And I love that phrase, quality of work life. So not surprised that in a lot of organizations, HR is responsible. That's not surprising. But I've seen, or, from my body of work and experience, bringing in some other folks to the table and collaborating with HR could be very beneficial, getting more voices at the table, and more resources essentially, but getting more voices and perspectives at the table to support HR, it would be very helpful. All right, next slide. So still thinking about leadership, we can also assess those leadership qualities or those leadership behaviors and practices of the people who are the stewards of the workforce. And because understanding that just in general, staff and clinicians who feel valued by their leadership, by their supervisors, et cetera, whose strengths are leveraged in assigning responsibilities and whose input is welcome, they're just more likely to be engaged and satisfied within your organization. Supervisor relations are a big factor when it comes to burnout, workforce turnover, and attrition, and dissatisfaction, disengagement, etc. So we want to pay close attention to what's going on at the leadership and supervisor level for sure. And again, it's not that you just are or aren't a good leader or a good supervisor. These things can be grown and trained, and so it's training can be put in place, and so that's why we don't have to ignore it and say, well, that is, that's the longest tenured staff member we have in the department, they might as well be the chair of the department. But we can look, and assess those qualities and put, maybe the better person for that job, or train those people that we really feel like can be in those positions. And so some example questions we can add to our surveys if they're not already there include, if you have a clear understanding, if your staff have a clear understanding of the goals and objectives of the company, because again, that goes back to how is leadership and how's the organization communicating these things, and do they also demonstrate them in their daily practice. Senior management keeps employees informed of company matters, goes back to that open and transparent communication and building trust. Company-wide communications being effective and useful, the company doing what is necessary to compete effectively. Next slide. I can see a clear link between my work and the company's objectives. This goes back to engagement and job satisfaction. I believe feedback from the survey will be used to make improvements, right? Senior management models our values. So if we work at a children's hospital, I've seen this from people close to me, where they work at for example, a children's hospital. And so you can only imagine, what the mission and the value statements are. But then we have supervisors who maybe don't embody that so well, and how that can be definitely a pain point for many. I'm optimistic about the future of our organization. I have confidence in our senior management. Just some sample questions. And there again, there are many validated tools out there, or even non-validated. There's many, many tools provided by the National Academy of Medicine, by CDC, by HRSA, you name it. Don't have to reinvent the wheel. We can just use what's already out there and adapt it to our needs. Next slide. The Mayo Clinic is another one. So the Mayo Clinic was another institution, as well as Stanford, who was doing a lot of the pioneering work in this area, even before COVID, and definitely during. And so the Mayo Clinic has an assessment you can use to look at individual supervisors, for example. And some of those sample statements were things like, if the supervisor is holding career development conversations, is empowering you to do your job, is encouraging employees to suggest ideas for improvement. And guess what? Not only can you assess what's going on, but as people are taking these surveys and they see these statements, they might say to themselves, ooh, I'm not really doing that right now, but maybe I can start to incorporate that into my practice. because this is going to be assessed again next year. So let me start working on some of these areas for improvement. So that you can find that on the AMA's website. I'm sorry, you can find that on the Mayo Clinic's website, and then the AMA also has some similar resources around assessing leader behavior to improve professional well-being. Next slide. In your experience, whether it's within your organization now or just in general in the state of healthcare, do you feel that supervisors and executive leaders prioritize staff well-being in their decision-making? Okay, we got a strong no there. And I understand, I know. And this is why I do the work I do, because I want to see that change. We've got a yes. So there is hope. Ooh, we're neck and neck, we're 50-50. So there is hope. So what I'm sort of seeing is that it's changed. Ooh, we've got more yeses than nos. So it sounds like, in general, the tides are turning. And I'm, definitely in the past, definitely when I was in training, in training residency specifically, my first one, it wasn't well-being. It was, at least in my system, my health system, it was taboo. It was, I literally, and I will never forget this. I will never forget this. But we had some of our attendings who said, well-being does not exist for a resident. And so I'm really glad that this is changing, that this culture is changing, because that is toxic. There's no room for that. Not when we have to both take care of ourselves and take care of our communities. There's no room for that. And so I think we're coming around. I understand that, at the forefront, maybe patient safety and well-being is the decision maker, or let's be completely frank and honest here. No sense in trying to divert or sugarcoat. Sometimes it's the business, the business needs that are taking priority over everything else. Not that it doesn't have a place, got to keep the lights on, but is it the end all be all of all the decisions at the detriment of our safety and our well-being, both for our staff and our patients? So I'm glad to see that yes went out today. And so next time we have this conversation, I hope that that pendulum continues to swing that much further into the yes territory for sure. So thank you all for sharing. Okay, and we're almost through here. So we talked about that chief wellness officer, or having, executive leadership dedicated to well-being, organizational well-being and resilience, that champion. But when we really want to think about sustainability, we've got to distribute that leadership. We've got to distribute that accountability. So it's not enough, to put all of the onus on, solely on one leader, but also makes more sense to delegate and to distribute that power, that decision-making power, that ability to help design the programs, to give that feedback from the very beginning, and also embedding it into the organization structure and operations so that it can persist even when that leader is gone, even when that chief wellness officer is gone, even when that champion is gone. It is embedded and it becomes a part of the culture of your organization. And so we can do things like the train the trainer model, or, identify champions in multiple departments of the organization who can be a part of these committees and these teams, who again have some portion of authority, who have some portion of accountability, and also that you're getting the people who are closest to the work, to the patients, as well, or giving multiple different perspectives, again, to develop these programs so that we're not just hearing from one voice or one perspective, but we're getting a nice, holistic, well-rounded perspective. And again, this goes back to empowering and encouraging as opposed to command and control. Feeling like, well, I know what's best for you, and asking, what do you believe is best for this organization? More buy-in. So if we empower people, we bring them into the leadership, the accountability, and the planning of these initiatives and these programs, going to be more bought in because they feel like they had a hand. They had a role in this. And so they're also going to want to see it be successful. Herson wanted to include this image specifically in terms of a very useful sort of model, which is the listen, act, develop, repeat. Listen, act, develop, repeat. Listen first, then act on it. So actively seek to identify and understand those well-being drivers. Act on it. Empower your clinicians, empower your staff to develop and implement solutions that address these top drivers in the work areas. Develop leaders, champions in the context of this, and repeat. Do your continuous performance improvement cycles, quality improvement cycles. What worked, what didn't, what can we streamline, what can we put more effort and resources into? Next slide. So our health center staff, so outside of the executive or the C-suite, outside of the CWO or the committee, well, the committee could be included, but our staff, frontline workers, actually engaged in designing and leading well-being initiatives at your org? Do they have a seat at the table, or is that something we're working on? Okay, of course, through the surveys and employee engagement committee. Great. Ooh, so at one organization, there's an employee empowerment group, which is open to any staff in the organization. And this information goes directly to a C-suite member to talk about employee wellness and concerns. But, and there's a but, clinical staff and front desk, patient access staff usually can't get away to attend. So what I'm hearing is there's an opportunity to improve that process, right? That maybe the timing of that group can rotate, or that people who want to attend can be given some sort of allowance to attend. There's definitely some opportunity there to make that more inclusive. They are not explicitly asked to be engaged, but HR is open to suggestions when provided voluntarily. All right. Next slide. So in conclusion, we talked about a lot today. Remember at the beginning, I talked about these guiding principles about focusing on those assets and bright spots, about focusing on system level interventions, measuring what matters and keeping it simple, co-creating solutions, and committing to cultural and systems transformation. So this transformation and change and competency building that is truly needed to create a resilient organization, it requires time, resources, and patience. It's not going to happen overnight. That's okay. We build one day at a time, 1 week at a time, 1 year at a time. Organizations that are committed to addressing burnout and promoting a culture of well-being and progressing, they, we can look at it as going through kind of 3 phases of growth, which is that developing those resources and programming, mentoring, and then improving. So we develop, then we improve what we have, through those PDSA cycles, those QI processes, and then sustaining it. So one of the things that we really have to look at and think about is, how do we make this sustainable? It's not enough that we put it in place and then it's gone after a year, but how do we make it sustainable and develop it and make it a part of our ongoing practices, policies, and culture? So I want to thank everybody for joining us today. And I hope that you took at least some things, whether it was inspiration or an idea or a talking point or resource, back to your organization or even to your personal life, to make things better, in terms of our own and our organizational well-being and resilience. So thank you so much. And Molly's going to close us out.
Thank you so much, Dr. Daywalker. That was a really thoughtful and very thorough presentation. And I feel like each of those domains could be their own presentation or podcast. There's so much more to talk about and share, but
Absolutely.
did a really great job getting through all of that in 2 hours. And thanks to everyone who stayed with us this whole 2 hours. We did want to mention that we have a couple of resources on the topic that we're providing from the NHSC Empowerment Initiative. They haven't been released yet on our website, but that will be happening in the next week or two. So do keep an eye out on our publications page. We can put a link in the chat to that publications page. And of course, we'll always email you when the new resources are released. So we've got a guide on developing organizational resilience and a compendium. They both follow that framework from the National Academy of Medicine around those 6 domains. The guide really follows pretty similarly to what's in the PowerPoint today. So if you do want to reference it in the future and share it with your colleagues, that could be a really great resource. And then the resource compendium is going to give you a lot of links to organizations and resources that can help you address all of the pieces that were mentioned today around workforce assessment and leadership qualities and also like chief wellness officers and really making that organizational commitment. And we can go to the next slide. We do have a little bit of time for Q&A, really just probably 1 or 2 minutes. So if anyone did have a question, feel free to put it in the chat. I don't see one at the moment, but I'll wait. I did have a question though, Dr. Daywalker, and that is, would you say there are certain factors that need to be in place for an organization to begin like embarking on assessing well-being at their organization and working on policies and practices, leadership qualities, setting up these chief wellness officers? Like, is there anything like a philosophical factor or just like an intent, some or funding, what needs to be in place for organizations to begin this journey if they're not already doing it?
Absolutely. So again, just that desire, and all it takes is one person to spark that conversation. It's hard for an organization to say that they're completely unaware about this concept of organizational and workforce well-being. You really have to literally have been under a rock for the last several years. But sometimes it's a lot harder to get there, especially when there's a lot of competing priorities and needs that just take priority. So it starts with one person raising that and having that passion, courage, and drive. And then, of course, not that we need, for example, financial resources to make or start the process, but they do help. And so that's where we get into getting that leadership buy-in and that organizational commitment, because that's how we're going to make those programs, those initiatives have staying power. So remember, there's a lot of free resources out there, a lot of free to the public resources that don't require any sort of permissions or fees to utilize, that you can take directly to your workplace, to your organization, and say, here's the business case. This is why we've got to do it. And here's also the value, the return and the value of investing in these programs. And you go from there. So it's, just takes one person, one spark to get it started.
Thank you. That's really helpful. And I know in previous webinars, we've talked about the cost of turnover of clinicians, and that can be a really great business case to provide if you're trying to convince leadership of making this commitment. That is all the time we have, unfortunately, and just want to thank everyone again for staying on with us today. And thank you so much to Dr. Daywalker for sharing all of her expertise. And thank you to our tech support team who helped make today's webinar possible. Just a reminder that we will be sharing the slides. Well, the slides are already available, but the webinar recording will be sent out in 2 business days. And the second webinar in this series will be next Thursday on the 18th. We're going to focus on those policies and workplace efficiencies that can be implemented to support organizational resilience. We encourage NHSC participants, clinicians, and of course, really leadership staff from NHSC-approved sites to attend. And you can see our presenter next week will be Judd Mallinger-Blount. He's from the Pennsylvania Association of Community Health Centers, Pennsylvania's PCA. So look out for an email with more details. Registration info is on our website right now. So you can go ahead and register for that one. We put the link in the chat too. Thanks, Josh. And we hope to see you all then. Thanks, everyone. And definitely remember to fill out our survey about today's presentation. Thank you again, Dr. Daywalker. It was excellent.
Thank you.
Thank you.